like as you are bones, so that is nothing but a part of skeletal system, right?
Ma'am, okay.
Yes, tell me.
Yes. No,
Ah, okay, so I will be like helping you to understand in detail about bones, which is important for your first MBBS knowledge and also for your exam. Okay, so the bone tissue generally, like what you have studied in your schooling and everything, the functions of bones is nothing but it gives protection. Okay, it gives movement, it stores certain minerals like calcium, phosphorus and lipids. It also helps in the formation of like blood cells like hematopoiesis, that is the production of all type of blood cells, okay, which are present in the bone marrow. And of course this bone is supporting the entire body. Okay, now when you just see the gross structure is nothing but when you look at the bone with your eyes, that's what is called as gross. Okay, so when you, Anjali, are you able to hear me? I'm finding your camera is stuck. Okay, see, when you just look at the gross structure of this gross, what does it mean? When you look with your eyes, that type of anatomy is basically called as gross anatomy. Like if you start with head and neck, upper limb, lower limb. So everything we study by looking with our eyes, which are very big and which are visible with human eye, you call it as gross structure. So when you just look at the bone like this is the skull bone you are finding. So the bone structure, basically if you see this skull bone, it looks like it has outer table and inner table, and in between you have a like meshwork. That means the bone, we have two different types of bone. One is compact bone and the other is spongy bone. Anjali, if you can keep your video mode on at least for today.
yes.
If you see the skull bone, like
And human.
okay, nice, very good. So when you have seen the bone, like try to observe when they give you bones, the outer surface of the bone looks very thick. Okay. But if you see some broken part of the bone, you will see some meshwork is there. Have you observed anything like
Yes.
that? Ha,
Yes.
yeah, that's nice. I'm happy. So, like that means like bone structure, basically it will have outer table which shows compact bone. Okay, inner table which is also compact bone, and in between these two you have a network of all like calcium tissue which is spongy in texture. Okay, so outer table, inner table, and then this is spongy bone. That means basically when you classify the bone, we have two types. This is one way of classification, like compact bone and spongy bone. Okay, so and see, if you just take the skull bone, outer table of the skull bone is compact, inner table of the skull bone, that means when you view from inside, that is also compact, and in between we have a spongy tissue. Okay, so now one thing you should know is the outermost covering of the bone is called periosteum. Okay, the outermost covering. So generally don't read any of these things and try to observe this picture. Basically non-vegetarian people will know like structure because they usually experience this type of things, but you are a vegetarian girl, right? See, outside the outer table is actually like you have compact bone. Okay, now this area where we have yellowish tissue, that is actually called as bone marrow. Okay, and this cavity is called as bone marrow cavity. So the outermost covering of the bone is called periosteum. Periosteum. Okay, so this is outer table, this is inner table, and in the middle basically we have spongy bone. Outer table is compact, inner table is also compact, and usually in between we have spongy bone, and this is lumen, that is the bone marrow cavity where we have the bone marrow. Okay, beta? Now, whatever is important for tomorrow's exam, I'm concentrating more on that. See, when you just look at this bone, outer table, we use the word periosteum. inner table we call it as endosteum. Okay, between the periosteum and endosteum we have the bone, that is compact bone, and in the middle you have an empty space, that is nothing but medullary cavity. This medullary cavity is filled with bone marrow, and of course the bone marrow color will change as per the age. Basically in very young bones you will see it will be red bone marrow because it is concerned with the production of the blood cells. As the age advances you will see the red bone marrow is converted to a fatty tissue and it looks yellow in color. You call it as yellow bone marrow. But throughout life we require hematopoiesis, that is the production of cells. That's the reason you will see towards the ends of the bone it is always spongy. What you have seen, the broken bones. Okay, and these spongy bones are containing red bone marrow. So red bone marrow is the place which is actively working for the production of RBCs, okay, and all different types of blood cells. Is it clear? Now if you observe this bone, now outer table is, what is the name I said? Outer.
Periosteum.
Yeah, very good. Inner.
Endosteum.
Yeah. What is this empty lumen called as?
Medullary cavity.
Okay. What is present inside the medullary cavity?
Yellow bone marrow.
Yeah. Yellow bone marrow. Like this. Okay.
Yeah.
Is it always yellow?
No, ma'am. It depends on the bone and the age.
Age. Depends on the age. Yeah. Very good. But red bone marrow is always maintained at the spongy ends of the bone. What is the reason?
Because the production of cells has to be.
Excellent. You are
Yeah.
understanding everything. I'm happy. Okay. Now see here. This bone has a hole. If you observe, it is shown here. So this hole is basically called as nutrient foramen. Okay. So nutrient foramen is the place where the blood vessel is entering inside and it will supply the complete bone. Okay. So that is nutrient foramen which gives passage to the nutrient artery. Okay. Which gives nourishment to the bone. Okay, so what is going on in the upper limb now in the college? Exactly what topic?
Ma'am, right now, they started pectoral region today.
Pectoral region. Have you come across a word like axillary artery or brachial artery? Not yet.
Yes, ma'am.
Yes, okay.
And it gave us objectives of what they're going to teach, and we
Okay,
had dissection.
okay. Now, if
They
you
didn't show us what it is. They just asked us to separate the skin flaps.
okay, you
That's it.
enjoyed doing it,
We didn't do it, ma'am.
at least watching
Uh,
it.
yeah, yes.
Okay, you will be getting a chance, don't worry, it will be on rotation basis. Okay, now see here, now when you just look at this like bone, you're finding one artery is going. What is the name of the bone you are seeing? Can you identify the name of this bone in the arm? What is the name we have?
Human.
Humerus, very good. So actually this bone what is displayed is humerus, and in the
Yes.
arm the name of the artery which goes is brachial artery. So why I'm talking about brachial artery is nutrient artery is derived from brachial artery. Okay. That. Now let us know certain terms which are important for tomorrow's exam. Okay. So we have towards the ends we have epiphysis. Epiphysis is the place where we have actively growing bone. It is basically cartilage which actually helps in the growth of bone. So epiphysis is basically found at two ends. At the upper end also we have epiphysis and at the lower end also we have epiphysis. Okay. Diaphysis is basically found at the center of the bone. Okay, and the junction of this diaphysis and epiphysis is metaphysis. Metaphysis. Okay, I'm repeating, center of the bone. This is all growing bone. Center of the bone usually where primary ossification center appears. The meaning of primary ossification center is the ossification which has started during intrauterine life. Okay, when the baby is in mother's womb, you call it as primary ossification center. So you will see the diaphysis is a place where we have primary ossification centers. Epiphysis is the place where we have the secondary ossification centers, which are seen after the birth. Okay, so the junction of diaphysis and epiphysis is nothing but metaphysis. Now you already know, like in long bone, when you have seen the structure of long bone, we have seen it has epiphysis, diaphysis, and metaphysis, right? So in the long bone, we have a medullary cavity. We know, as you said, we have yellow bone marrow. Red bone marrow is also seen in infants. So basically, this bone marrow is intended for the production of blood cells. Okay, then so just one point you should know, red bone marrow, it is hematopoietic producing tissue. Okay, then yellow bone marrow we find in adults. Okay, so generally yellow bone marrow will not have the power to produce blood cells. But suppose if our body is in requirement of different types of blood cells, then yellow bone marrow can revert back to red bone marrow based on our body's requirement. Okay, now coming to classification of bones, this will be asked for tomorrow's exam. Okay,
Yes, ma'am.
so from here you need to concentrate more. So according to position, we have axial bones and appendicular bones. Okay, so I will show with the help of picture also. According to us, this question was asked for your immediate senior batch.
Okay.
2020 batch had this question for 5 marks. Okay, so according to position, we have axial and appendicular, and according to ossification, we have membranous bones, cartilaginous bones. We have certain bones which ossify both in membrane and cartilage. I will help you to understand these terms with diagrams. You will understand easily. And according to shape, we have long, short, flat, and irregular bones. Okay. Now let us see. There is one more classification based on the like shape. Okay, now if the bone has upper end, as you have already studied humerus in your college, if it has upper end, lower end, and shaft, you call it as long bone. Okay, there are certain bones which are small in size. Okay, so these are called, like you seen, you should have come across this term like she looks too pretty, try to catch her. It's a code to remember carpal bones. Okay, scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. All these are small in size, hence they are called as short bones. If you just look at the skull, it looks flat. You can actually, we can also feel in our own head, right? So these are flat
Yes.
bones. Okay, then this is vertebral column, which is shown in blue color. And if you just observe this bone, it is very much irregular in shape, hence you call it as irregular bone. Okay, beta. So that is
Yes.
classification of bone based on shape. Now, according to shape, now you have to see once this question will be pakka asked tomorrow. I will share my PowerPoint, which this slide onwards you need to pay a lot of attention. I said right then. So long bones. So typically they are longer. That means width is less and length is more. Anjali. Okay, so
Yes.
it has the shaft and it has head. Okay, and basically few examples, already one example you have studied, that is humerus. In the lower limb there is one more bone which is long, that is femur. Okay, so typical long bones are like femur, they are very much long in size, isn't it? 40 centimeters, 50 centimeters, typical long bones. But if you just observe in the like hand, here you also have carpal bones. If you observe in the foot, there are metacarpal bones. That means they also have upper end, lower end, and shaft. Same typical features of long bone, but their height is small. Their size is small. Hence, they are called as
Miniature short bones.
are short long bones. Okay, examples are metatarsals and metacarpals. Modified long bone. Now see here, you should have studied clavicle in detail. Okay, so it is horizontally placed. So that is also one of the modified long bone. Now short bones. I said like one code just now. So generally short bones are cube shaped. They will have six surfaces. Like this, what I am holding a sharpener, like six surfaces. Superior surface, inferior surface, near to midline, medial surface, away from midline, lateral surface, in front, anterior surface, behind, posterior surface. Like that, almost all carpels and metacarpals, they have 6 surfaces, of which 4 are articular. That means anteriorly, if you just observe this bone, see anteriorly it is articulating with metatarsal. Okay, posteriorly it is articulating with the proximal row of carpal bones. On right side it is articulating, on left side it is articulating. That means almost 4 surfaces are articular. Only surfaces which are above and below are non-articular. They are not articulating with any of the bones. Okay, so if you just break and see these bones, they are spongy in nature mostly. Examples are carpals and tarsals. Okay, so all these are short bones, beta. Flat bone. Where do we find flat bone?
Skull. In the skull.
Skull. Very good. So only one skull bone, one piece of skull bone is shown here. That's the reason you could not answer fast, isn't it? So in the skull, we have so many bones. In fact, they are all fused by sutures. Okay. So that's why only one piece of bone is shown here. That's why you could not identify flat bones. Generally, they are thin and flat. They are usually, you can see they are curved, isn't it?
Yeah.
Curved. Okay, and examples are skull bone is flat bone. Best example, that is sternum, is also one of the flat bone. Scapula, what you have already studied, that also comes under flat bone. Okay, now you can see this is skull bone. I told you so many pieces of bones are connected by sutures. Okay, the
Yes, ma'am.
details we will study when we do head and neck. Now these are
Yes.
irregular bones. One example is vertebra, very much irregular in shape. Okay. Then pneumatic bones. If the bones are filled with air, they are called as pneumatic bones. Like in skull bone, like if I'll take you to skull bone again, see, this is the place which is called as maxilla. If you break
Yes.
this bone, inside you will see it is like a box where empty space is there. Even this frontal bone will have empty space. Sphenoid, ethmoid, like that. We have different bones which have cavities, empty spaces, air spaces inside, okay, which will make the skull bone light in weight. Do we feel the heaviness of our head?
No.
Why? Because our bones are filled with air. Balloon filled with air. It is so weightless, right? Similarly, our skull bone and many like bones, few bones are filled with air to make it lighter and also to add resonance to voice. Okay. So pneumatic bones
Yes.
generally they are seen in the maxillary, frontal, ethmoidal and sphenoidal bones. Okay. So these are all forming paranasal air sinuses. That means around the nose, empty spaces are called paranasal. They are filled with air, hence they are called as air sinuses. If there is any infection in this area, we call that condition as sinusitis. In winters, we generally suffer, isn't it? So much pain here, running nose, headache, and all. That is nothing but those are the clinical symptoms of sinusitis. Okay, so like that, these are the pneumatic bones. They are filled with air. They are present all around the nose, opening in the nose. Hence, they are named as paranasal air sinuses. Okay, beta. Now, sesamoid bone itself may come as 2 marks question, 3 marks question. Okay, any bone which is developing in tendon, okay, you call it as sesamoid bone. Okay, like in the previous bone, long bone, I said outermost cover is periosteum. Okay, but here those bones are developed either in membrane or cartilage. But here, this bone is not developed in membrane or cartilage. It is developed where?
Membrane tendon.
Tendon. It is developing in tendon. Hence, it doesn't have any outermost covering, that is periosteum. Basically, in long, like you should have studied in your intermediate also, we have Haversian system in the bone.
Yes.
Isn't it? So that Haversian system is also missing in sesamoid bone, and they usually ossify after birth. Wherever pressure is more, pressure points, knee, lot of pressure is there over knee, right? So in such pressure points, like when the baby is crawling, trying to stand, walk, lot of pressure will be there over the knees, then you will see such bones develop. So such bones are sesamoid bones. Example, best example we have is patella. Apart from that, we have other bones like in carpal bones. There is one bone that is pisiform and fibula. Okay. Now, what are the functions of sesamoid bones? First thing is they resist pressure, they minimize friction, they alter the direction of pull of muscle, and they maintain local circulation. Okay. Now, sesamoid bones, I kept few pictures. Now, see, this is front of the thigh. This is the muscle
Yes.
and this is the tendon, Anjali. Within this
Yes, ma'am.
tendon, you are finding bone has formed. That is patella.
Yes.
And the name of
Patella.
this muscle is quadriceps femoris. So, in the tendon of quadriceps femoris, we are seeing the development of patella. The other details, if you can remember, anyhow, I'm telling you, I will share this PowerPoint. Two more examples or one more example, like PC form, it is developed in the tendon of flexor carpi ulnaris tendon. Similarly, one or two you can remember. See, this is flexor carpi ulnaris, we see in upper limb. So here the bone develops, you call it as sesamoid bone. Okay, like that many are there. Okay, now we have certain bones which are extra in number. Human body has how many bones?
Do not say.
Very good. Apart from that, sometimes there are supernumerary bones, extra bones. You call such bones as accessory
Access.
bones. Okay. So, like they fail to unite with the main bone mass and they remain like pieces of bones which are shown in different color. Okay. That is. So, they are basically called as sutural bones. For accessory bones, you can draw rough pictures, Anjali, when you are giving your answers tomorrow. Always
Yes.
anatomy is incomplete without diagrams. Even if you
Yes.
write less, if you give rough diagram, you will get full marks. So practice drawing diagrams right from the beginning. May not be artistic, just rough. Only one picture, one round circle and some sutures, one extra bone there. Give the name sutural bone itself. That is enough. Even if you write minimum less sentence also, you will get more marks. As you said just now, we have 206 bones. Okay. So now we are classifying them like into axial and appendicular, isn't it?
Yes.
So this axial skeleton, which is found in the midline, it has around 80 bones. It has skull, thoracic cage, sternum in the midline, vertebral column. This is appendicular skeleton. These are appendages, upper limb and lower limb. This is pelvic girdle, and with the scapula, clavicle, and humerus, we call it as pectoral
Like,
girdle. Okay, then now the names are anyhow these names just for your information, because all these bones we are going to learn in detail in a span of 1 year. Okay, so like in the axial skeleton we have skull bone. In skull further names are given. Now you don't worry to remember all these names, not required. Only this table is enough. The first one what we have. Okay, see, this is appendicular skeleton. So many names again you need not remember. Okay. So long bone, I said this primary center of ossification, if you remember it, diaphysis.
yes.
Isn't it? So the part of the bone which develops during intrauterine life. Okay, so all bones will have this primary center of ossification except for tarsal and carpal bones. Okay, they are, that means they are developed after birth. Okay, secondary center is that which forms which accessory part of the bone is ossified. That means apart from the center, the ends of the bones, they are basically ossified from secondary centers. Okay, so usually they develop after birth. So the lower end of the femur, upper end of the tibia, few examples are here. Now these terms will be asked for tomorrow's exam. What is diaphysis? So part of the bone ossified from the primary center of ossification, and it is forming shaft of the bone. Okay, this is shaft. This is upper end of the bone, this is lower end of the bone. Okay. So epiphysis, ends of the bone I said is epiphysis. It is composed mostly of spongy bone. That too, it is cartilaginous in nature, isn't it? Then,
Yes.
as long as epiphyseal cartilage is there, you will see the bone will grow in length. Okay. Once this epiphyseal cartilage is ossified, we cannot grow taller anymore. So that means epiphyseal cartilage is responsible for the growth of the bone in length. Okay. Now that's what is written. Epiphyseal plates allow for growth of long bone during childhood. New cartilage is continuously formed. Older cartilage becomes ossified. Cartilage is broken down and bone is replaced by cartilage. Now see here, Anjali. Look at the screen. Suppose this
Yes.
is femur, and here you are finding this cartilage is there, epiphyseal cartilage. So it is all full cartilage only. Okay. As long as this cartilage is there, we will grow tall. Once it is ossified, bone growth is over. This is simple diagram which I want you to learn. So simple it is. See, diaphysis in the center, epiphyseal cartilage at the ends. This is also epiphyseal cartilage. And the junction of diaphysis and epiphysis is metaphysis. What is it called as?
Metaphysis.
Metaphysis. We know already this is medullary cavity. Inside lining of the bone is endosteum. Outside lining of the bone is,
Periosteum.
yeah, periosteum. Okay. Now even this question may be asked like what are the different types of epiphysis? Okay. So we have four different types of epiphysis. Okay. You can just frame a code to remember PAT. PAAT. PAT. One is pressure epiphysis, traction epiphysis, atavistic epiphysis, aberrant epiphysis. So pressure epiphysis in the sense, see, wherever pressure is more, pull is more in a particular part of the bone, if that place, if epiphysis is developed, you call it as pressure epiphysis. See, it's articular. That means it is usually seen at the joints. That is the meaning of articular, which helps in transmission of weight. Example, pressure epiphysis we find with head of the femur, anything, head you can write, head of the humerus, anything. Now, traction means pull. So it is basically non-articular and does not take part in the transmission of weight. Okay, it provides attachment to usually like tendons which exert a traction on epiphysis. That is traction epiphysis. Atavistic. That means it is basically independent bone, but during development it has come and fused with some other bone. This bone you have studied already. What is the name of this bone? Scapula.
Scapula.
What is this process you are finding?
Coracoid process.
Very good. So coracoid process is the best example of atavistic epiphysis. It's independent bone, okay, which is actually becoming fused with the rest of the bone. Okay. So that is the meaning of atavistic epiphysis. Okay. As you said, it is coracoid process of scapula. One more example you will be learning in lower limb. This is basically talus bone, and the tubercle of the talus is also one of the example of atavistic epiphysis. Okay. No, you have already studied this bone, that is scapula, and this is our coracoid process. Best example for atavistic epiphysis. Now the last one we have is aberrant or absent epiphysis, not always present. That means epiphysis is not there. Okay, basically for the head of the first metacarpal. Now, law of union. See, oh, the meeting is going to end in few minutes. Okay, see, law of union of epiphysis. You know, this different colors I have used here. This is diaphysis area. Epiphysis area I have used green. And the junction of red and green is nothing but metaphysis. Okay. So the same thing is zoomed out. This is law and all we will discuss later. See, nutrient foramen is the place where you will see the blood vessels are entering. Now, what is the meaning of growing end of the bone? The growing end of the bone is situated against the direction of nutrient foramen. Suppose if the nutrient foramen's direction is downwards, opposite to that, that means upper end of the bone is the growing end of the bone. Okay, that
Okay.
word you try to remember. It is situated against the direction of nutrient foramen of that bone. Okay, so actually there is a dictum, to the elbow I go. That means the growing end of the bone for the humerus is lower end and for the radius ulna is upper end. To the elbow I go and from the knee I flee. Flee in the sense, see, lower end of the tibia fibula are growing ends and upper end of the femur is growing end. That is the meaning. Okay. Yeah. Metaphysis, I said, junction of diaphysis and epiphysis is nothing but metaphysis. Okay, it's also actively growing area of long bone. Here, when you see the blood supply, I will show one different picture where you will see the coils of blood vessels, which are called as hairpin blood vessels. If you see, you will understand more. Here, you will see the attachment of muscles, ligaments, and the capsule of joints. Usually the ends of the bones are covered with cartilage. You call it as articular cartilage, also called as hyaline cartilage. Okay, then which reduces the friction. Now these are the epiphyseal cartilages of a small like boy or girl who has still growing bones. Can you see ends of the bones are still showing epiphyseal cartilages? Okay, that is. So this is, I said, blood supply of bone itself is very important question. Okay. So now I said there is a hole called as nutrient foramen through which the nutrient artery is going inside. It's going into the lumen. It is showing one branch which is moving upwards, one branch which is moving downwards. This is the point where we have metaphysis and it is just showing hairpin bends, coils, upper end and lower end. Okay. So nutrient artery and juxta epiphyseal or metaphyseal arteries. Okay, outside the periosteum. Towards that means these arteries are now penetrating and they are moving outside towards the periosteum. They are called as periosteal arteries. So nutrient artery, metaphyseal artery, epiphyseal and periosteal arteries. So nutrient artery basically is derived from the nearby blood vessel. For example, for humerus, brachial artery gives the nutrient artery. So it divides into, see, parallel vessels like this. And this is the metaphysis point where you are finding certain bends which are called as hairpin loops. Okay, these are the hairpin loops or hairpin bends. Okay.
Yes, ma'am.
Periosteal arteries are the arteries which are seen from outside. Okay. So this we will do when we do histology. Like these branches only will enter into the Volkmann's canal, the Haversian system and all. Metaphyseal arteries is at the metaphysis. They actually form the round coils. Okay, they pierce. Mm, just checking, like epiphyseal arteries towards the articular cartilage we have one. Okay. So if these epiphyseal arteries are damaged, the bone will degenerate, that will die. And that condition is called avascular necrosis. That means bone is not growing due to non-availability of blood supply. That's what is called as avascular necrosis. Okay, so if the blood vessels at the articular cartilage are blocked, such injuries happen. So one is at the articular cartilage and epiphyseal cartilage, which are continuous and which are not continuous. Okay, here you can see this is like articular cartilage and this is our epiphysis and they are continuous. If they are not continuous, this is one more. Now, ossification, you just try to know these two terms, intramembranous ossification and endochondral ossification. Anyhow, the details of this will be explained again when you do histology of bone. If the bone is basically ossifying in membrane like skull bones, basically They will be in the form of membrane, and if they get ossified, you call it as intramembranous ossification. But initially, if the skeletal framework is cartilage, within the cartilage, if bone starts ossifying, you call it as endochondral ossification. Humerus is best example for endochondral ossification. Skull bones are best example for intramembranous ossification. Okay. Two types of ossifications we find in the clavicle. Best example, both intramembranous and so all these details. Now see here, this is the summary of what basically this is cartilage. This cartilage is gradually being transformed into bone. So such type of change we call it as endochondral ossification. Okay.
Yes.
Best example I said is humerus femur, you can write.
Yes.
See, as the age advances, what happens? The bones will get degenerated and they become porous. That condition is called as osteoporosis. Generally, we find osteoporosis after menopause when hormones are also not there, estrogen and progesterone. Okay. If the bone is growing too tall, you call that condition as gigantism. We find due to excess of growth hormone. Opposite is dwarfism when growth hormone is less. Okay. So we have certain fractures with bones. Okay. So different types of bone repairs by making use of certain splints. Okay. Fracture healing and all is not required. See, you can see this is the normal bone and this is osteoporotic bone. Okay, where so many pores are seen. Okay. So if you are studying with BD Chaurasia, you can go with BD Chaurasia. Okay.
Yes.
Or there are many other books also. No, don't change